Hi, my name is Christina Kraft. I am a holistic integrative dentist and oral systemic health consultant. I am going to share an article today with you that I learned a really cool fact from. It is called Oral Microbiome, a review of its impact on your oral systemic health. And the fascinating thing, one of the fascinating things I learned from this article, because there was a lot, was the statement that decreasing stomach acidity can shift the composition of the oral microbiome into the gut microbiome, which means the bacteria from your mouth can make its way down to your gut. Now, this might not seem like such a big deal, but it really changes how we process food and how our stomach works. Our stomach is full of stomach acid, and when people take things like proton pump inhibitors, which a lot of people take for acid reflux, heartburn, indigestion, it decreases your body's ability to make stomach acid, which sounds like a good idea because then you don't have the heartburn. Unfortunately, that stomach acid is really important for our health, and it creates a barrier between our mouth and our gut because the bacteria in our mouth cannot live in that acidic environment. But when that acid is low, then bacteria in your mouth can migrate down into your gut. So when this happens, you get all kinds of dysbiosis happening not only in your mouth, but in your stomach, and your ability to digest food goes down. And the more important thing that happens is that you get chronic inflammation starting to happen because those bacteria are not supposed to live there, and they trigger all kind of immune responses in your body and cause inflammation to rise. This leads to things like irritable bowel disease, Crohn's disease, even colon cancer, and all of the other whole body inflammatory processes that happen when your stomach is inflamed. So the specific bacteria that there's most studies about moving down into your gut is called Porphyromonas gingivalis, and that is the big bad red complex bacteria, one of the big causes of periodontal disease. And you may be wondering how this affects you. 80% of the population has periodontal disease, and a lot of people are harboring this bacteria in their mouth, underneath their gums, and it's just eating away, causing all kinds of inflammation in your whole body. But if you have that and you take a proton pump inhibitor, which a lot of people do, they're overprescribed, they're only supposed to be used for a short amount of time, and doctors are leaving people on these medications for months or years. So you have this gum disease, 80%, plus this proton pump low acid situation. You're actually causing more harm by trying to treat the acid reflux by allowing your bacteria in your gut and your mouth to commingle where they're not supposed to in your stomach. So this is one of the things that I test for as an oral systemic health consultant. I do oral DNA testing to see if you have these types of bacteria, and then we dive down deep into the other things going on in your health, in your life, and in your medication usage to see how these things are contributing to whatever other chronic conditions are affecting you, specifically in this case, mostly your gut. So if you'd like to learn more about that and how you can get tested to see if your oral microbiome is helping you and is in happy symbiosis, or is it in dysbiosis, it is not doing so hot, please contact me and we can look at that. Have a wonderful day.